Hi everyone, Dr. Nemechek here. I want to touch base again about POTS and COVID. So POTS is P-O-T-S, Postural Orthostatic Tachycardia Syndrome. This is occurring in growing frequency after COVID infection. Basically, you have trouble regulating blood pressure to your brain to a different degree, and your heart rate often is racing. Now, this doesn't only happen in adults. Here's another paper showing it's happening in the pediatric population as well. Now, typically you go get evaluated. They do these tilt tests, these things like this, and most providers still don't understand you can actually recover from this. This is from an inflammatory state that people have, and so they end up providing you with a bunch of just symptom-based treatments. And so here they're like, just lay down, don't stand up too quickly, watch out for temperatures and these things that make it worse. Here, get more salt in your diet, or here's some drugs that'll boost your blood pressure. Here, compression socks, things like that. Here's some other drugs to boost your blood pressure. Sometimes because the pressure's so low, the norepinephrine levels will rise and it can make you feel panicky or fearful. And so all these drugs listed here block the norepinephrine levels. And so, but none of these make you better. They're just kind of blocking the symptoms. And we have now a growing number of papers that are showing that vagus nerve stimulation can literally improve the way your nervous system works. And here, this study, so the vagus nerve controls inflammation in your body. So it's reducing inflammation. And in this study, people did an hour a day, and within 2 months, so here is the change in heart rate from laying to standing. So this is going to be the sham. It's like a placebo. They get something on their ear, but it doesn't do anything. And the active current, which the currents we use for vagus nerve stimulation, you don't feel. So you can't tell the difference whether it's on or off. And you can see in just 2 months here, this drop in this active group means their heart rate doesn't jump as much. So they're already showing improvements here. Now, the primary effect here is by decreasing inflammation. Okay? That's what our protocol does in general. If you came here and saw me, we put you on a protocol. We balance your gut bacteria with rifaximin. We use fish oil, olive oil to lower inflammation. Here it is, vagus nerve stimulation, okay? And then for people who've had COVID, we always treat for possibly COVID leaky gut. That's a short course of this glutamine. So that's what you put on. Typically 4 to 6 months, you're fixed. Everybody's better. And for a short while, we got a special on our VNS device, the Vitality Smart Cable at vitalitysmartcable.com. Use a special code that you'll see in the description for this video. You can save $150. All right. So do yourself a favor, start the protocol, and give us a shout. That's all for today. Everybody, take care.